We observed the health status of middle school students in Texas and looked at the environmental and behavioral factors related to various health outcomes. Based on the disease burden we found among middle school students, we suggest 4 priority health areas that we want the Texas legislature to be aware of during the 2013 legislative session. These areas are obesity, chronic diseases, asthma and diabetes, sexual health and teen pregnancy, and mortality of unintentional injury-related deaths and violence-related deaths. We have made recommendations based on our literature review for decreasing the prevalence of these health outcomes. One area of importance we chose to focus on is obesity in Texas middle school children. In 2009, 20.4% of youth 10 to 17 years old in Texas were obese, with Texas ranking 7th for childhood obesity out of 50 states plus Washington, D.C. A research study examined 6th and 7th graders and their scores on the Texas Assessment of Knowledge and Skills tax measures for the 2006-2007 school year and compared their grades and scores with their weight status of obese or non-obese. And obese students were found to have lower grades and lower tax scores compared to non-obese students. This is one reason among many that obesity needs to be focused on in Texas middle school students. Our first evidence-supported recommendation is to implement more programs such as the Texas Public School Nutrition Policy to ensure healthy eating for middle school students in Texas. Research has shown that middle school students who participate in this policy consume fewer sweetened beverages and snack foods and more nutritious foods such as milk and vegetables. More programs similar to the Texas Public School Nutrition Policy can enforce that healthy food is being served in school during lunchtime and in vending machines. Also, national standards state that students should be active for 50% of physical education class time. The national average for time spent active in physical education class is 27%. A research study examined whether middle school students in Harris County, Texas were meeting national standards in physical education class, and the study found that in classes in Harris County, they were falling below the national average for time being spent active. More time needs to be spent in schools focusing on physical activity and healthy life choices, and a policy should be implemented to require that a certain percentage of time be spent each week focusing on healthy life choices. Next, we would like to implement programs in Texas middle schools to focus on preventive health activities and to teach middle school students about health risks that are associated with obesity. And finally, it is imperative that Complete Streets legislation be passed in Texas. The Complete Streets has already been passed in 13 other states, and this legislation ensures that people who ride bicycles, use public transportation, walk, or are motorists have safe access to streets. This would result in traffic around schools being reduced, and students would get moving in the morning and be able to safely get to school to learn when they arrive at school. These are goals that middle schools in Texas should focus on.
In Texas, diabetes is the second most prevalent disease of childhood, with prevalence varying from 0.3% to 0.5% in males and females respectively. In terms of ethnic variability, non-Hispanic blacks have the higher prevalence of diabetes as compared to other races. Since type 1 diabetes is caused due to autoimmune destruction of beta cells, we want the Texas legislature to support the research for gene therapy as a solution to this disease. Type 2 diabetes is increasing among kids, and so is the prevalence of obesity. But since this is a new epidemic, we recommend supporting of extensive research to study the risk factors and pathogenesis of type 2 diabetes among kids. This can be successful if type 2 diabetes is made reportable in the pediatric population. We also recommend regular blood sugar screening among high-risk children to identify the disease in its incipient stage. Asthma is the most prevalent chronic disease of childhood in Texas. When we look at the graph here, then we see that the Texas rate is similar to the national rate in terms of the prevalence for asthma. Our recommendation is to educate teachers, parents, and children about asthma symptoms. This is based on the fact that 15 to 54% of asthma hospitalizations are due to preventable causes, and thus they can be prevented with proper education. Furthermore, primary care physicians should be made required by law to ask about asthma symptoms. Respiratory infections such as influenza has been found to be clinically more severe in asthma patients. Thus, subsidizing influenza vaccine may decrease the morbidity associated with this condition. Lastly, allergy testing in high-risk children may help to identify the allergen and thus its removal from kids' surrounding can be helpful in preventing asthma.
Why did we choose sexual health and teen pregnancy as a priority health topic among middle school students? It's because Texas is ranked third among the US states in teen pregnancy rates. This graph shows that middle school students constitute less than 2% of the total teen pregnancy rate, and high school students form the majority. Just pay attention to the column within the red circle in this graph, and you can see that most pregnancies in 10 to 14-year-olds lead to either abortion or fetal loss, which is the light blue and the green area, compared to live births, which is the small dark blue area right at the top. Our recommendations to prevent teen pregnancy include sexuality or sex education be made mandatory in all middle school curriculum, to teach the students abstinence plus, which is abstinence as well as safe sexual practices. This has seemed to be more effective than teaching them only abstinence, and to focus on teen mothers to prevent repeat pregnancies, as Texas has the highest repeat teen pregnancy rate. The school condom availability program to be implemented in schools, as it is shown to decrease teen pregnancy rates by increasing condom use. Parental education to help parents talk to teens about sexual activity. Texas is ranked fourth among the US states for AIDS cases among adolescents, and sexual contact seems to be the most common route of HIV transmission in this group. Texas is also ranked fourth for chlamydia cases and sixth for gonorrhea cases among teen females when compared to other US states. These are recommendations to prevent STDs and HIV in middle school students. To include STD and HIV prevention education in conjunction with sexuality education in middle school curriculum, annual confidential screening of sexually active females, and to promote expedited partner therapy, which is providing medicines to the patients to help treat their partners.
For 10 to 14-year-olds, unintentional injury death rate in the United States from 2000 to 2005 was 7.2 per 100,000, while 8.1 per 100,000 was reported for Texas. It was higher for males than for females. In Texas, unintentional motor vehicle traffic accident is the top leading cause of injury deaths among 10 to 14-year-olds. Recommendations to prevent mortality due to motor vehicle crashes include the introduction of an enhanced enforcement program for seatbelt laws at specific locations and times, enforcement of the 0.08% blood alcohol concentration laws, lower BAC laws for young or inexperienced drivers, and the introduction of selective breath testing and random breath testing. We could also introduce legislation for ignition interlock devices. These are devices that disable a vehicle's ignition after detection of alcohol in the driver's breath. Introduction of primary enforcement laws that restricts handheld cell phone use while driving, community mobilization through education and awareness-raising efforts, prohibition of control of alcohol sales at events. Recommendations to prevent violence-related deaths include introduction of school-based programs that include topics or skills that are intended to reduce aggressive or violent behavior in middle school-aged individuals, the introduction of regulatory policy that would restrict licensing of handguns, the disruption of illegal gun markets, and the introduction of a gun buyback program. There could also be an increase in the taxes on guns, restricting imports and prohibiting ownership of guns. Other recommendations to prevent violence-related deaths include increasing the waiting periods for gun purchases and forbidding sales to high-risk purchasers, introduction of child access prevention laws, and the introduction of zero tolerance of firearms in middle schools. Based on our recommendations, we suggest that actions are taken now by the Texas legislature to protect the health of middle school-aged individuals and our future. Thank you for listening.